Well, good morning, everyone. You're the people who fought the weather and won. I think we some people who fought the weather and didn't win. But thank you all for coming, and a particular thanks to Rory for coming from Irish Aid. And Shams has come from WHO in Geneva, and it's just great to have the opportunity to have Shams with us, and he's going to be with us through the day to benefit from his experience. We also have some other travellers from other places who will be introduced during the day. I'm going to follow Rory I'm going to talk about the context that we're working in quite a bit, and I think what you've set the scene very nicely, I think, from an Irish Aid perspective. And really just to touch on one thing you mentioned about maximum impact. And I think that's why we have a session like this. We're all doing different initiatives in different places. And I think for all of us, we want to be effective in what we do. And the idea of today is to come together and learn from each other. Say, how can we do what we're doing better? Now, Nadine said this is significant. It's number 3, the third forum. Actually, it's also number 5, because it's 5 years since the ESTHER program, ESTHER Ireland, was launched in the neighbouring college, in the Royal College of Surgeons, by the minister then, Joe Costello. So 5 years, good time to maybe to look back and take stock. And we've seen a lot happen in 5 years. So, as Rory said, the history of this goes back actually decades, the work we do. But in a very organised way, it goes back maybe more recently. And it was 2010 when the HSE started a global health programme. And that's when the first MOU was signed between the HSE and Irish Aid. And what we see over the years, of the 5 years since the ESTHER programme was launched, was a mushrooming of work around institutional partnerships. So there were partnerships there already. Some of them they've continued to grow, with lots of new partnerships. And through the ESTHER programme, we've had the opportunity to be involved with maybe 25, 30 different institutions who are on this journey of developing partnerships. And we've been very fortunate to have the support along the way from Irish Aid, which has enabled us to provide small financial support to institutions that have been developing links. So now we have, as Rory mentioned, work across maybe about 15 countries, mainly sub-Saharan Africa, but also in Asia. And as you see, if you look at the mapping of it, a lot of the countries where Irish Aid is present, which I think is very helpful in lots of ways. So I'm going to maybe reflect a bit on the last 5 years, just really say, well, how has the context changed that we're working in, and looking at it at the global level down to and what's happening in Ireland. Because I think to be effective, I think we need to have that understanding of while we might be working in one institution or one part of a health system, what's going on around us, I think, is an important determinant of how effective we're going to be. So I think that's really setting the scene for today, which is about saying, well, how are we progressing? Or what is it we're trying to do, and how are we doing it? And where are we going from here? And I think one of the next steps for us in partnership is to move on from not looking at the countries where we're working with in low-income countries, but to ask the question too, how do we bring back the learning here in Ireland? Our health service could benefit from learning from others. There's lots of opportunities, so that will be a subject of discussion through the day. But of course, when we look at the global context, we immediately talk about the Sustainable Development Goals, and this is what's moved on since we started a few years ago, moving from the MDGs to the SDGs. And while we have now more goals and a more integrated agenda, we see health everywhere here and across all of the goals. But I think for us who work within health institutions and in the health service, well, we see it's SDG 3 is where we see our place. That's where we fit in. And along with that, SDG 17, which is really the SDG that talks about how we're going to achieve these goals. And it goes into more elaboration of what it is to work in partnership, something we talk so much about, but the question is always there, do we do it well or not? And this talks very particularly about North-South partnerships for technical cooperation and technical collaboration. And again, that's where we fit in. We're part of the way in which SDG 3 is going to be fulfilled. But the SDGs are very helpful, I think, in giving us kind of a roadmap or direction for how it is we're going to have this better health for all. And it's about, a lot of it is about universal health coverage. This idea that everyone, everywhere gets the health care they need without experiencing financial hardship. And that speaks to me a number of things about the work we do in partnerships. Firstly, it says if you're going to reach everyone, you've got to think about national health systems, because it's countries' health systems that will have as their goal is to try and provide health care for everyone. So that's a question. How do we, when we work in individual institutions, contribute to that wider health system that is there to try and reach everyone? And when we talk about universal health coverage, we talk about this sometimes as AAAQ. It's not just about that the healthcare exists, but are people getting the healthcare they need? Is it available? Is it accessible? Is it acceptable? And is the quality good enough that they're actually going to make a difference? And it's great that the next speaker, Shams, is going to talk to us about the quality of care, because that's something, a very key aspect of what we can address through partnerships. The services are there, but through partnerships can we to improve the quality. But the other side of UHC that it's look at when we talk about covering everyone and looking at the national level, what about the ones who we need to reach? There's been so much good progress reaching more people over the last decade or so. But as you reach more people, the ones that are not reached become hard. They're the hardest to reach. That's why they're unreached. And we know that often government health services and systems are not the best to reach the hard to reach. And I think this is where we can come in. So who are these hard to reach? Why are people not getting universal? Why do we not have universal health coverage now? Who's not being reached? And is that it's about where people are living? Is it because they're geographically remote? Is it about their culture, their ethnicity, that they're not able to access care? Is it about certain conditions they've got, that there's a stigma associated with them, like leprosy, TB, HIV, whatever? Is it their gender? Is it sexual orientation? So for a whole lot of reasons, people, and if we're going to achieve universal health coverage, it is about leaving no one behind. And I like that aspect of that whole UHC discussion in SDGs. It's thinking of the people. And I think that's where we can play a role in reaching some of these people. And I'll talk a bit more about that. But I think to understand when we're working in this field that it's a complex global system we're working in. And at the country level, countries have their health plans. But along with that, you have all these global organizations organize themselves to try and work in support of countries. And it seems to me to be an ever more, it's always evolving, but an ever more complex environment that we work in. So we have only in the last few weeks a global action plan for SDG 3 with the multilateral organizations and the big funding organizations signing up. We have the whole movement around UHC 2030, universal health coverage, with WHO trying to coordinate and lead around trying to coordinate organizations to work together. Irish Aid is very much part of that and is funding the UHC partnership with WHO. And then you have various funding instruments. Another one in the last year is the Global Finance Facility funding maternal, neonatal, child, adolescent and reproductive health services. So there's all of this complexity. And the point really to make around this is that for us to be effective in what we do, we need to have some understanding of what's going on around us, these many organizations and how they're trying to work together. And it challenges us to be coordinated, to be collaborative, to be aligned with what countries themselves are trying to do. And I think this is where our relationship with Irish Aid is so helpful. Where we're working in countries where Irish Aid is present, we have the opportunity to meet people in the staff and the embassies there who can really give us some really good insights into the situation in the country. Then for greater impact, we need to work with others. And I hope Rory doesn't mind me picking up on a couple of things he said a couple of days ago at another seminar. He was talking about Irish Aid, but he talked about Ireland is small. We're a featherweight. Well, I'd like to think that maybe we can move up a division, maybe become a welterweight perhaps. But it is, if we work together, and he talked about that we'd be more effective by working with others. And this is another kind of feature of our work today, with linking in with WHO, with the role that they play in every country and their work around health partnerships that we'll hear about, working as part of the wider European alliance with other ESTHER countries, TET in the UK, their health partnership programme, and I don't see him here yet, but Graham Chisholm from TET will be with us during the day. So working at this other organisations is really helps us to be more effective, and is a very practical example of that. Through the ESTHER Alliance, we've done this mapping. We have a collaboration platform where we map what all of the different countries are doing, the partnerships, where they're working, what they're doing. And this is an aid to us to be able to work together in countries where we know who else is working there and how might we work together more effectively. So that's the global context, and then it's back the landscape in Ireland. And just to say a few things about that, I think the white paper is really very important for us, because I think one of the things for us is about how do we connect with what Irish Aid is doing, how do we align with the policy, and we've had an opportunity to input to it, and we'd be very interested to see how that unfolds, to connect with it. And then we have our various health institutions in Ireland making a contribution to the Sustainable Development Goals. And an important thing as part of the context for us is that we have a very supportive environment now from the Irish Health Service and the HSE. And just a few indications here of the demonstration of the commitment of our organisation and the leadership in the HSE to the work we do, with the renewal of the agreement last year with Irish Aid, a Global Health Office, new partnership agreements, taking on the ESTHER programme, and so on. And the HSE having, I think, a much better appreciation of the need to be a global organisation. And it is about what we can contribute. We need to work in solidarity with other countries. We saw that, for example, with the Ebola epidemic. We also need to see how to work with other countries is in our interest, actually. It is in their interest, but it's also in our own interest. And that we can learn, and that's one of the things we really want to develop, is the learning from other countries. So the HSE has a role in the 2030 Development Agenda. And SDG 3 the SDGs are for all countries. It's for Ireland and it's for other countries. And you see these tiles around the wall, and I'm hoping to get a set of these tiles put up in the HSE headquarters. And someone said, well, we only put up tiles that are things to do with HSE work. And I said, yes, this is HSE work. This is part of our agenda, both in Ireland and further afield. So another quote from Rory de Burke, he talked about furthest behind first. And really, I think he was talking about the authenticity of the Irish Aid programme and what is it distinctive about what we do. And I think this is a question for us. What is our distinctiveness in the fields that we're working in partnerships? And the furthest behind first is I think it's that idea of no one left behind. And I think that may be a hallmark of what we do, the contributions we make. Some of us work in, maybe we think we're small institutions, but we can contribute to this, reaching people who are not reached. And we'll hear today about some examples. I'm not going to go into them, but just some really nice examples of what seem like maybe small partnerships, but I think very significant impact in reaching unreached. So we'll hear about, and we have colleague Isaac from Malawi, the Eden Park Surgery has a partnership with the Association of People with Albinism in Malawi. And if you hear the stories of the challenges that people living with albinism in a country like that, and the lack of services, and through this partnership, the opportunity to start to develop services and linking with the government and start to put policies and strategies in place. Another example in Nepal, leprosy. We hear that leprosy is eliminated in most countries. It's eliminated in Nepal. What does that mean? It means the population is now very low. But actually, there are many new cases in some parts of Nepal. And the Public Health Department in the Midwest is supporting the leprosy work there through training, capacity building, and research. So I'm just giving you some examples that you'll hear more about during the day of the kind of ways in which we can be part of this agenda of leaving no one behind. And part of the agenda of strengthening health systems, which is a key pathway to universal health coverage. And during the day, we'll hear more about some of these partnerships. Rui referred to the partnership in Mozambique, improving quality of care. I won't go into details, but now we're at a point of, now that we've been doing this work for over 2 years, we're undertaking evaluation. So we're starting in a very concrete way to learn the lessons, and we'll hear something about that today. With Sudan, we'll hear about the partnership with Sudan, as Ayat is here from that partnership, and here the focus is on strengthening the health workforce, another key part of the health system. In Zambia, again, medical training, it's human resource strengthening and donating equipment particularly to training hospitals that both expand services that people don't currently have, as well as contributing to training. And now the Ministry of Health in Ethiopia has asked us to start to partner with them initially around the area of improving quality of service. And we'll hear another, and it's not just some of these national partnerships that the HSE is involved in, but another example, another practice, this is the palm surgery in Gori, with having their partnership in Malawi, and addressing non-communicable diseases, huge challenge. that countries face. And we have some learning around that we can share. And I know there's some others. Professor Richard Firth is also going to be talking about that later. So we have the opportunity through some of these partnerships actually to help build strong, resilient health systems, which is what countries need. Strengthen the workforce. One of, I think, our niche may be around how the connection of national policies to the frontline services. Lots of work at the policy level for UHC, but who is translating that into better frontline services? Who is building the strong institutions that are needed across a country that make up a strong health system? This is where we have a contribution. Improving quality and safety in services, extending reach, developing new services for unmet need, and embedding sustainable change. And that's just as getting to finish. You in your pack will have a copy of this tool. This is called the EFFECT tool. And just an example of the work we've been doing with our European colleagues to address this question of how do we know what we're doing is effective through partnerships? There's lots of evaluation tools. But one of the things we really need to understand is how do we work effectively as partners? And we've worked over the last couple of years to develop this tool. It's just gone online, and we're going to be encouraging those who have established partnerships to use this tool. An important thing that Rory said is how do we, we need to kind of capture the evidence and learning from what we're doing and then share it. And developing tools is one part of that. So we're learning lessons. I won't go through this. This is really the subject for today, is learning and sharing lessons between ourselves. We're learning a lot as we go along. We're always learning. Let's use the opportunity today to learn from each other and bring some of these lessons back to Ireland.